This video is created by Nihar from YouTube. This video is created by Nihar from YouTube. Ventilator ventilator is a machine that provides mechanical ventilation by moving breathable air into and out of the lungs to deliver breath to a patient who is physically unable to breathe or breathing insufficiently. Ventilators are computerized microprocessor-controlled machines, but patients can also be ventilated with a simple, hand-operated bag valve mask. Ventilators are chiefly used in intensive care medicine, home care, and emergency medicine as standalone units, and in anesthesiology as a component of an anesthesia machine. Ventilator bird2 the bird vip infant ventilatorspecialtypulmonology edited on wiki. Ventilators are sometimes called respirators, a term commonly used for them in the 1950s, particularly the bird respirator. However, contemporary hospital and medical terminology uses the word respirator to refer to a protective face mask. 1. Function: a standard setup for a ventilator in a hospital room. The ventilator pushes warm, moist air, or air with increased oxygen, to the patient. Exhaled air flows away from the patient. In its simplest form, a modern positive pressure ventilator consists of a compressible air reservoir or turbine, air and oxygen supplies, a set of valves and tubes, and a disposable or reusable patient circuit. The air reservoir is pneumatically compressed several times a minute to deliver room air, or in most cases, an air-oxygen mixture to the patient. If a turbine is used, the turbine pushes air through the ventilator, with a flow valve adjusting pressure to meet patient-specific parameters. When overpressure is released, the patient will exhale passively due to the lungs' elasticity, the exhaled air being released usually through a one-way valve within the patient circuit called the patient manifold. Ventilators may also be equipped with monitoring and alarm systems for patient-related parameters, e.g., pressure, volume, and flow, and ventilator function, e.g., air leakage, power failure, mechanical failure, backup batteries, oxygen tanks, and remote control. The pneumatic system is nowadays often replaced by a computer-controlled turbopump. Modern ventilators are electronically controlled by a small embedded system to allow exact adaptation of pressure and flow characteristics to an individual patient's needs. Fine-tuned ventilator settings also serve to make ventilation more tolerable and comfortable for the patient. In Canada and the United States, respiratory therapists are responsible for tuning these settings, while biomedical technologists are responsible for the maintenance. In the United Kingdom and Europe, the management of the patient's interaction with the ventilator is done by critical care nurses. The patient circuit usually consists of a set of 3 durable, yet lightweight plastic tubes, separated by function, e.g. inhaled air, patient pressure, exhaled air. Determined by the type of ventilation needed, the patient end of the circuit may be either non-invasive or invasive. Non-invasive methods, such as continuous positive airway pressure, CPAP, and non-invasive ventilation, which are adequate for patients who require a ventilator only while sleeping and resting, mainly employ a nasal mask. Invasive methods require intubation, which for long-term ventilator dependence will normally be a tracheotomy cannula, as this is much more comfortable and practical for long-term care than is larynx or nasal intubation. Life-critical system edit: because failure may result in death, mechanical ventilation systems are classified as life-critical systems, and precautions must be taken to ensure that they are highly reliable, including their power supply. Ventilatory failure is the inability to sustain a sufficient rate of CO2 elimination to maintain a stable pH without mechanical assistance, muscle fatigue, or intolerable dyspnea. 2 Mechanical ventilators are therefore carefully designed so that no single point of failure can endanger the patient. They may have manual backup mechanisms to enable hand-driven respiration in the absence of power, such as the mechanical ventilator integrated into an anesthetic machine. They may also have safety valves, which open to atmosphere in the absence of power, to act as an anti-suffocation valve for spontaneous breathing of a patient. Some systems are also equipped with compressed gas tanks, air compressors, or backup batteries to provide ventilation in case of power failure or defective gas supplies, and methods to operate or call for help if their mechanisms or software fail. 3 Power failures, such as during a natural disaster, can create a life-threatening emergency for people using ventilators in a home care setting. 4 Battery power may be sufficient for a brief loss of electricity, but longer power outages may require going to a hospital. 4 History Edit. Learn more. This section needs additional citations for verification. April 2020. The history of mechanical ventilation begins with various versions of what was eventually called the iron lung, a form of non-invasive negative pressure ventilator widely used during the polio epidemics of the 20th century. After the introduction of the drinker respirator in 1928, improvements introduced by John Haven Emerson in 1931-5, and the Both respirator in 1937. Other forms of non-invasive ventilators, also used widely for polio patients, include biphasic Curis ventilation, the rocking bed, and rather primitive positive pressure machines. 5 In 1949, John Haven Emerson developed a mechanical assister for anesthesia with the cooperation of the anesthesia department at Harvard University. Mechanical ventilators began to be used increasingly in anesthesia and intensive care during the 1950s. Their development was stimulated both by the need to treat polio patients and the increasing use of muscle relaxants during anesthesia. Relaxant drugs paralyze the patient and improve operating conditions for the surgeon, but also paralyze the respiratory muscles. A machine with hoses and gauges on a wheeled cart. An East Radcliffe respirator model from the mid-20th century in the United Kingdom. The East Radcliffe and Beaver models were early examples. The former used a Sturmey Archer bicycle hub gear to provide a range of speeds, and the latter an automotive windscreen wiper motor to drive the bellows used to inflate the lungs. 6 Electric motors were, however, a problem in the operating theaters of that time, as their use caused an explosion hazard in the presence of flammable anesthetics such as ether and cyclopropane. In 1952, Roger Manley of the Westminster Hospital, London, developed a ventilator which was entirely gas-driven and became the most popular model used in Europe. It was an elegant design and became a great favorite with European anesthetists for 4 decades prior to the introduction of models controlled by electronics. It was independent of electrical power and caused no explosion hazard. The original Mark I unit was developed to become the Manley Mark II in collaboration with the Blease Company, which manufactured many thousands of these units. Its principle of operation was very simple. An incoming gas flow was used to lift a weighted bellows unit, which fell intermittently under gravity, forcing breathing gases into the patient's lungs. The inflation pressure could be varied by sliding the movable weight on top of the bellows. The volume of gas delivered was adjustable using a curved slider, which restricted bellows excursion. Residual pressure after the completion of expiration was also configurable, using a small weighted arm visible to the lower right of the front panel. This was a robust unit, and its availability encouraged the introduction of positive pressure ventilation techniques into mainstream European anesthetic practice. Types of medical ventilators: invasive and non-invasive are the main 2 categories. Invasive, a tube is either placed into the patient's airway or is inserted through a hole made in the neck. These ventilators are also called mechanical ventilators, and they take over breathing for the patient entirely. They are used when the patient is unable to breathe on their own or require extra help to breathe efficiently. Non-invasive, the patient wears a mask that fits over the nose and mouth, and the air blows into their lungs. Depending on the condition of the patient, a respiratory therapist will determine what type of ventilator will be used for them. COVID-19 pandemic. See also, list of countries by hospital beds. 2020 coronavirus pandemic. The examples and perspective in this section may not represent a worldwide view of the subject. July 2020. The COVID-19 pandemic has led to shortages of essential goods and services, from hand sanitizers to masks to beds to ventilators. Several countries have already experienced a shortage of ventilators. 4154 governments, including many in Europe and Asia, imposed restrictions on medical supply exports in response to the coronavirus pandemic. 42 The number of ventilators varies by country. When data is often not available for ventilators specifically, estimates are sometimes made based on the number of intensive care unit beds available, which often contain ventilators. 43 United States Edit. In 2006, President George W. Bush signed the Pandemic and All Hazards Preparedness Act, which created the Biomedical Advanced Research and Development Authority, BARDA, within the United States Department of Health and Human Services. In preparation for a possible epidemic of respiratory disease, the newly created office awarded a $6 million contract to Newport Medical Instruments, a small company in California, to make 40,000 ventilators for under $3,000 apiece. In 2011, Newport sent 3 prototypes to the Centers for Disease Control. In 2012, Covidien, a $12 billion per year medical device manufacturer, which manufactured more expensive competing ventilators, bought Newport for $100 million. Covidien delayed and in 2014 cancelled the contract. BARDA started over again with a new company, Philips, and in July 2019, the FDA approved the Philips ventilator, and the government ordered 10,000 ventilators for delivery in mid-2020. 44 On April 23, 2020. NASA reported building, in 37 days, a successful COVID-19 ventilator, named Vital, Ventilator Intervention Technology accessible locally. On April 30, NASA reported receiving fast-track approval for emergency use by the United States Food and Drug Administration for the new ventilator. 45, 46, 47 On May 29, NASA reported that 8 manufacturers were selected to manufacture the new ventilator. 48 NASA Vital ventilator.